Hello, I'm Alex Metrocardi, Chief Marketing and Public Relations Officer for Living Branches, and today is Friday, November 13th. Welcome, and welcome to Ed Brubaker, our President and CEO.
Thank you.
I guess let's start with an update on where we are. We have testing cases to report again. So we have both in Dock Terrace at our Dock Woods campus and in healthcare at Satterton. You want to talk about that?
Yeah, we actually have two situations in healthcare, as you said. At Dock Woods, we have one person who tested positive, one staff member, and so we needed to close the facility and do our testing. We also had the same situation at Satterton, where a staff member had tested positive. Since that time, I think we had another one who tested positive on the Dock Woods campus, if I'm not mistaken. And so that will push our 14-day period of time out a bit further. What that means is then we need to go into a testing mode. And so we did the first round of testings last week, and we do more this week and then again next week. We also probably will talk later about the reality that we're moving toward weekly testing in healthcare from monthly because of the infection rate in the county. But it shows the power of one, right? Mm-hmm. One person meant that we needed to do that. That's not to blame them, but just to say that's how serious this is and how seriously we, and frankly, the state and federal governments are taking it. Having said that, when we went through the testing, we had no persons out of that testing. I mentioned the other person that became positive, but that was because she had symptoms, not because of our regular testing. Zero. All came back negative. And so, honestly, I don't know that I was expecting that because the community infection rates are going up all over the place. And so just to be at that place, to have that was really great. Can that be sustained? Probably not. But it was very interesting to see that. I'd like to think, although we don't have scientific proof to back it up, that wearing these and appropriate PPE makes a difference. And so we do believe it does, and we hope we never go back to the infection rates we had in April, May, and June. But I got to tell you, the numbers across the country and in Pennsylvania are not looking good.
Yeah. I had an interesting conversation with our infection control nurse this morning, trying to understand as I'm getting ready to send out an email to families in healthcare, updating them on our testing situation. I wanted to make sure I understood what was going on. And what she was sharing with me based, because when you hear, there's now 2 cases at Dock Woods, that starts to sound a little bit concerning. But she was sharing that based on the contact tracing that they did, and also the fact that those 2 employees never were in the building at the same time together, they really don't think that the first employee gave the virus to the second employee. They think that it's 2 separate situations, and that, again, as you said, hopefully the mask wearing, the PPE really is making a difference.
That's right. And it would appear, although we don't have 100% certainty, that they did not contract the virus within Living Branches. I don't know that we can ever say that with 100% certainty without more research, but it would appear that it came from relationships on the outside. And so the positive of that is it feels like we're having some measure of, I don't even want to use the word control, but influence. But it really is important, and we're going to talk further in this video too about the upcoming holidays, the things all of us do or don't do or shouldn't do with the upcoming holidays that really make a difference,
Well, that's a great segue. You sent out communication this week to all of our residents and their family members. From yourself and Dr. Hamowitz, our medical director, and Dr. Rose at Tri-Valley. So maybe we should talk a little about that.
Yeah, and really it was about being aware of what you were doing over these upcoming holidays, Thanksgiving and Christmas, who you were hanging with, and how many. And I know CMS is saying you shouldn't even be having any family gatherings. And I think I shared the last video that Lucy was in charge of her family's gathering this year, and that was canceled. And frankly, some members of her family may have been, what's the big deal? On the other hand, I can tell you that they come from Central PA, Big Valley, and I know Valley View Haven is having a problem. And I say this because I think it's public knowledge, not to out them or anything, because we've had problems too, but they didn't have issues to date. And all of a sudden now, I think as of the other day, they had 44 cases in healthcare.
That's so hard.
This is a place, let's just put it this way, mask wearing is not a popular activity in that neck of the woods, okay? And I have family roots out there too from generations ago. And the culture there is very independent, but it's really important to wear masks. I'm not saying for sure, certain that's what the issues were there. We don't know. But it was a place that did not have the issues we did early on, and perhaps even thought they might be escaping it, just like North Dakota and South Dakota thought that. Now these are places that it is a really hotbed of COVID. And so we just need to pay attention. And if at all possible, that we not have those family gatherings this year, really, or have them small and you know where the people have been, and to do it that way. Because as Lucy heard on somewhere on the radio or wherever, let's do the safe things this year so we're all around next year and can have our gatherings then. And so it's hard. I get it. It's really hard. But we really need to watch it. And it's so easy, I'll speak for myself too, to get complacent. But we need to be disciplined, particularly at this time of the year. Just really, really important.
I had an interesting conversation with a resident at Souderton, actually, who called me asking for advice because she had family members who wanted to come and visit her for the Thanksgiving holiday. And she basically didn't want them to come. Not that she didn't want to see them, of course, but she was very uncomfortable, but they really wanted to come. So I was brainstorming with her some strategies that she could use to try and minimize her risk as much as possible. And so we talked about not serving a meal. If they were going to eat, that she should go in the other room while they're eating. And above all, to make sure that they keep their masks on while they're in her residence.
Right. Yeah, that's right. And the eating, it's one of the most unsafe things we can do with other people because we don't have our masks on, right? And we're eating with each other. We might be, shouldn't be, but talking with our mouth full or whatever. And, things are moving around the room, shall we say. And so it's really important that we avoid those kinds of activities. Just to talk about some of the things I'm evaluating, I'm in local Rotary Club. I was president last year and want to be supportive now that I'm, immediate past president. But I had attended some meetings when we were meeting outside, and we do have Zoom meetings too. Now we're indoors at the country club. I haven't been there yet, and I'm not sure when I may go. And if I go, I'm probably not going to be eating, going there for the program and wearing my mask. I say that not to be critical of the fact that they're meeting, because people have to make their own choices. But for me, in the position I play in this organization and the example I want to be, and particularly now when the rates of infection are going up, we're in a challenging time and we need to pay attention very closely, in my opinion.
An hour ago, we just got information from Montgomery County that they've now voted they're going to close the schools for 2 weeks starting November 23rd. So yeah, if there's not a sign that infections are rising and they're taking it very seriously, I don't know what that is.
Yeah, that's right. And it really comes back to we need to do the right thing now. This is all the opening the economy and hitting coronavirus. These are not mutually exclusive. They're interconnected, interrelated. And I don't think I'm not a believer that we can shut the economy down completely. I'm also a believer that we need to pay attention to the medical experts, and we need to find that place that's going to have the best chance of success. It's not one or the other, it's both and. Because frankly, if there's no economic activity, there's no money to pay for the care that needs to happen. And so it needs to be a combination. And I would say for the most part, our leaders are trying to do that. In the state, I know many people have differing opinions on that. I get that. But I don't subscribe that, our governor is trying to do things to shut down the economy. I'm like, why would you do that? You have no revenue coming in then if you do. But it's really both and. How do we work together? And that's probably another point too, and I spoke to that in the last video. We need to work together. Republicans and Democrats need to work together. This is not a one side or the other. This is together trying to figure this out, working together, not putting roadblocks in. Let's talk to each other. Let's work it out. Let's believe the best in each other and find ways that we can work together to get to the other side. Because that's really the only way we're going to do it.
It's going to take all of us.
That's right. That's right.
Well, we do have a resident question this week, and it's a simple one, so I'm sure you'll like this one. The question is, and of course I'm being facetious, but the question is, how is Living Branches attempting to address the psychological, emotional, and spiritual needs of its residents given the pandemic restrictions?
Wow, you were being facetious, but it is an excellent question. It really is, because we really spent a lot of time looking at the physical well-being, and that's important. I mean, if you've passed on, all those other things really don't matter, right? Having said that, keeping you alive physically and keeping your heart beating is not the only thing that defines life. And so I would say that's been one of the hardest things for the coronavirus response team to work at that, because you're trying to find balance, right? And I know there are families out there and residents that felt we were, frankly, too tight or too loose, both sides, really. I've heard both. And I would say overall, though, people have been very respectful, okay? But it is hard, because you say that emotional connection with people is really important. Now, I can say this, our staff have been doing a wonderful job with connecting with our residents. We just stopped our weekend coverage again, but 2 weeks ago, one of the last weekends, I was on, and I happened to be at Dock Woods and the Willows, and staff were overall in positive spirits, and you could tell that they really cared about the residents, and they knew that for some of these residents, they were their connection. And so that is maybe first and foremost the direct caregivers, CNAs, nurses, dining service workers, housekeepers, anyone that's interacting. There's an opportunity for a connection to be made, and that is certainly was pre-COVID, but it's really important now too. But we are doing music therapy in a safe manner. I mean, we have all kinds of different protocols to manage that in a good way, and that was quite the process to get there, because singing without protection can be a challenge. So we've come up with, I think, a good plan. But that Sunday services are happening, although in a small group. Pastors are visiting. We use handheld devices for trying to encourage people to visit their families. Until we had these positive cases, we had visits happening. So we're really trying to work at this stuff, because the person that asked this question, I suspect they had an underlying bias or thought that this is important too, and they're absolutely right. And so we're trying to work at that within the regulatory constraints we have to work in, within safety protocols, but recognizing that it's not just about keeping one's heart beating. There's a whole lot more to life, right? So I would say that's probably one of the hardest things that we've had to work through, and the saddest things, frankly, because when we're making decisions in CRT, it pulls at our heartstrings too, because we have families, we have parents, we have grandparents. We know this is not easy. And so weighing all those and balancing that. you may have other things to reflect on too, because I know you're out and about as well and observing what's happening in that regard.
Yeah, you're right. I was at the Willows actually last week with Mike, our videographer, doing a photo shoot, and we happened to stumble across a music therapy session that was going on, and had an interesting conversation with the intern who was running that therapy session, and so I love talking to the interns because they're not necessarily long term at our organizations. So they're students. They've come for a semester or two, but they get around to the different campuses and they see who's here. And this particular intern was reflecting that he was seeing such a marked difference between the last couple of weeks and now these couple of weeks, because Willows had come out of its pandemic protocols. We'd had a positive test, and so they were, not able to meet in groups and things like that until recently. So they had come back out of that, and it was just so fun. All of the residents had an instrument. We were all playing. Everybody was laughing and happy. And it was so nice to see that. And our intern was reflecting on how much it meant to him to be able to be a part of that process and that event, to be able to bring joy to people. And so it reassures me when I come out of our CRT meetings or in the other things that we do here in this building and actually make it back to campus to see that life still is going on there. Not exactly the same way it was before, but there's still a lot of joy.
Yeah, and maybe you can just speak briefly too about what are some of the creative approaches that we're using for music therapy to keep it safe, but also help it to happen.
Well, one of the things that, of course, we've all realized is that as soon as you put a face mask on somebody, and then once you put a face shield on someone, it becomes increasingly difficult to hear whoever's speaking. So we've actually purchased, I believe they call them amplification devices. They're actually like tour guides would have. So little microphones that come, a little pocket amplifier, but it really does allow the person who's speaking to speak in a much louder voice. So that's very helpful. And then, of course, the residents as well. They're all wearing masks. And at this particular session, there was one resident who was not terribly excited about wearing the mask, but there was a caregiver there who was making sure you have to keep it on. And most people were trying pretty hard to do that. And of course, everything is sanitized after they use it. Everyone's sitting 6 to 8 feet apart from each other, and everyone is singing softly, which when you really start doing research into the singing, as we now know from our CRT, it's volume. So speaking loudly or shouting is no worse than singing softly. So it's the projection and the level of volume. So all of those things are taking place, and we do feel pretty confident that it's a safe activity.
Yeah, no, that's very helpful because it also gives people watching the video a sense of, the thought process that you need to put into these things to get to the place that you can actually do what is helpful, but keeping it safe even while you're doing that. So that was very helpful. Thank you.
It's very enjoyable to go to campus and realize, hey, there's still great things happening.
Mm-hmm. Yep.
You had a great idea that I heard about. Something called Christmas in March. Would you care to share?
Christmas in March. I've heard of Christmas in July, but yeah. And what I was talking about, and I referenced that earlier, be safe this year so you can all be around to be together next year. And, I know that the day of the holiday for many people is like Thanksgiving Day. That's Thanksgiving. But I remember when I got married, and I was the youngest in my family and last to get married, and my mom loved to get together on the holidays, but she also realized that now, in addition to 4 children, there were 4 in-laws, and so you can't always get what you want. I think there was a song in the '60s from that, but so you have to say, is it about the day of, or is it about being together? And right now, I think we need to say it's about being together at some point hence when we can be safe and we can have turkey in March. We might have difficulty getting a nice fresh turkey from Bolton's in March. But the point is, it's about being together, right? And based on some stories I hear from some families, some people might be just as happy not to be together with their family this year. I mean, you talk about stress-filled holidays. I mean, I'm being facetious, but that is the reality in some cases. But the point is this: let's be safe now so we can be around to be together later. And let's celebrate Christmas in March, or it may not even be by then. It may be Christmas in July or whatever. But the point is, let's be focused on what we can do and how we can be creative with it, as opposed to what we've lost. And I think that's a critical piece of resilience too, right? Mm-hmm. To focus on what you still have, what you can do. I mean, I've often looked at people who, there was a story on TV the other night about this person in the military who had his legs blown off in Afghanistan. And he, through yoga, really, he became a yoga instructor, and that really made a difference in his life. But then he connected with other people. And I'm sure if he might still prefer, obviously, to have his legs, but he's never getting them. So he had to come to terms with that. And he found ways to make his life incredibly meaningful. It was a very moving story. And whenever I see things like that, I'm like, wow, interesting, right? Yep. Whatever our stage in life, we need to figure out, how are we going to see what we have? I mean, both Lucy and I have lost siblings to auto accidents, and in my case, it was my brother and sister-in-law. Well, it was many years ago, but at that point in time, you had to figure out, you had to grieve. You have to go through the stages, but you also need to focus on hope for the future and the opportunities. And for us, it was their 2 kids that were still with us. So you got to focus on what you have. I really do believe that's so important. And I'll speak for myself too. It's easy to focus on what you've lost. I mean, I'm not saying it's easy to do or that I do it perfectly, but I've found in my life that it's a mindset change, and we need to focus on what we have.
This ties beautifully into our Montessori principles of focus on what you have, what you can do.
That's right.
Not what you can't.
That's right. And I would love to see my in-laws and the whole family together this year, but I'd really prefer to have my in-laws around the next time we get together. And so what can we do to be safe?
Yeah. Well, good advice. Yeah. Thank you, Ed. And thank you for watching. We'll be back in 2 weeks with our next video update. And in the meantime, if you have questions, please feel free to email them to coronavirusquestions@livingbranches.org. Thank you.